Hi, everybody. Stacy's here with our COVID-19 pop-up panel. Thank you again for attending today. Folks are still signing up. We have a good group today. We have some awesome panelists. I'm so excited to have them with us. So I just want to say a quick hello and welcome to everybody. Please put in the questions box if you can hear and you can see me, just so that we have our own little quick tech check here. We do have a couple of handouts, and I'm really thrilled to announce that hot off the presses, Brian Cordes has shared their version 1 of samples protocols that some organizations have been using throughout the COVID-19 crisis. So they have shared the practices that are used by clinics. This is an organic document. It's a working document. Things will change. If you have information that you want to share, please feel free to email susan@neighborhoodcats.org if you have information that you'd like to share. But if you go into the handout section, you can certainly download that, that first handbook that we have. And Brian and Susan, thank you so much for all of your hard work from Neighborhood Cats in collecting this information, as well as I believe Alley Cat Advocates was a big contributor, as well as some other organizations. So please feel free to download that. And then there is also a photo that Karen Kraus from the Feral Cat Coalition, who is chatting today, shared a picture of how they're utilizing some of their social distancing in their clinic. All right, my first poll question, is your clinic open? So we have 12%, the clinics are open and they're actually opening normally. Then we have 42% that are open, but only for emergencies. And no, we are totally closed, 45%. So we are definitely not fully open yet, but we may be working towards that. One more quickie. This is, I'm going to launch this poll. Does your clinic spay, neuter owned, cats only, spay, neuter, feral, TNR, return to field, or spay, neuter both? So 89% of folks attending do spay, neuter for both owned cats as well as feral, TNR, return to field, whatever you want to call them. So 89%, basically, if it needs it, it gets it. So that's great. We only have 3% that spay, neuter owned cats, and then we have 8% that only do feral, TNR, and return to field. So that's fantastic. So really good information. I appreciate you all responding. So without further ado, we have 4 panelists today. We have Audrey Garrison here from Operation Catnip, Ruth Steinberger from Spay FIRST, Karen Kraus from the Feral Cat Coalition of Oregon, and Dr. Sara Pizano from Team Shelter USA. So the 4 of them are gonna share their quick thoughts on how things have been going for them and what they're looking forward to. Karen is gonna do a more detailed look at fundraising. So she's gonna talk about the topic of fundraising, because that's gonna be even more important for our organizations as the clinics move forward. And certainly, you know, there's been lost revenue. So without further ado, Audrey, are you out there?
I sure am. Hello, everybody. Thank you for joining us. Operation Catnip is probably a little bit different than any of the other organizations. There are normal operations, even our smaller, regular-sized clinics on the weekends. We provide clinical and surgical opportunities for vet students. That's a big part of our mission. On Saturdays and Sundays, those clinics might have 6 to 10 vet students, plus 3 staff technicians, and maybe a part-time records person. The Friday clinics wouldn't have as many vet students, but usually a couple, and techs and the like. And we utilize another organization's facility. We only do spay and neuter for community cats, and we help our partners when other capacity is not available for them and we have the room. We don't schedule them, but if we have room, we provide services for them with that. And we also have a kitten shelter diversion program where those are the only cats that don't get ear tipped. Over the last month, one of the things that we did in March, we began instituting some additional cleaning and social distancing protocols. And probably like the rest of you, it seemed to change daily. what was needed and wanted. We suspended our clinics after our clinic on March 20th. My medical director and I spoke in the wee hours of the morning of March 20th and decided that our particular model was really not conducive for us to be able to do it safe. And we had also been seeing a significant drop in cats that would actually showed up. In other words, a big increase in our no-show rate. Normally, our no-show rate is about 30% for the cats that people try to trap, but you know how cats are, they don't show up all the time. For the March 20th clinic, our no-show rate was over 70%. We have been paying everybody all along. We've continued to engage and pay staff and providing opportunities for them to work their regular hours, including the clinic staff, by providing and assigning them various tasks that needed to be done anyway. We initiated some telemedicine. We're providing tech appointments for the participants in our KSD program. We've been creating and updating protocols and checklists, and the staff have been attending webinars and obtaining CE credit where necessary that's pertinent to their positions. We did apply for and receive a PPP loan with the first draft that's helping with rent and utilities and payroll for April and May. And we used funds from our emergency reserve fund that helped us for those couple weeks in March that we weren't really working. We are not currently open. We are hoping to reopen, but we're not currently open. But what stopped us was when we made that decision, Alachua County was experiencing the highest per capita rate of infection of any county in Florida, and we thought that that was pertinent. We don't have our own space, and that can be an issue. We don't have control of it. People come and go and the like. We're not an emergent care provider, and we were experiencing those extremely high no-show rates, which makes scheduling difficult, and it's hard to justify putting people at risk when you're not making the kind of impact that you're accustomed to make. And a couple of our staff members either are or live with someone who is greatly at risk. We felt, and we still feel, that suspending the clinic operations for our situation was what we needed to do, even though we firmly believe as an organization, and me personally, that spay and neuter for community cats is not an elective procedure, and it's essential to the health and well-being of cats. But we needed to be able to provide those services without jeopardizing human health. And at that point, we didn't see that we were able to do that, particularly with the high rates of infection in our county. Our plans going forward, though, we are planning to reopen. We hope to reopen on March 9th. That's what we're working towards. But we're reworking our clinic model. We're going to have limited, consistent staffing, no volunteers. We're working out no intrusion into the clinic space by the host staff. We're requiring staff to take their temp at home the night before and report it so that our medical director can get an idea of what kind of staff she has available. But we're planning to retake temperatures again prior to the clinic. Obviously, no one with a fever may attend. Additional and enhanced PPP for the clinic. We normally wear masks and gloves in the surgery suite, but the staff that's outside doesn't have to wear masks. But we want everybody to wear masks, gloves, and cleaning of surfaces at regular intervals. And I'm really looking forward to looking at Brian's handout and protocol, because I imagine we'll be adding stuff to that. We also need to alter our caregiver support. We're going to have staff deliver traps using proper social distancing protocols and limited interaction. Staff will also pick up the cats when they're trapped and complete the the check-in process in the field, get donations if they're not already made online, and transport cats to the clinic the night prior to the clinic. Cats will recover with us overnight. They don't normally. Caregivers pick up cats the same day, but they're going to recover with us overnight so that staff can return the cats and release them in the morning and bring the traps back to be cleaned and inventoried. We're also going to continue in our enhanced kitten shelter diversion support. And with that, we provide caregivers who are taking care of mama cat and the kittens, or bottle feeding kittens if mama cat isn't around. We help them keep the kittens healthy with medical care and the like, and set them up for spay and neuter when they're 2 pounds. We've been doing that during this suspension of services, and we're going to keep doing that. We know that there's going to be more, although actually here in Gainesville, Florida, we're very lucky. Although we do have a bit of a kitten season, none of the shelters are crowded or overflowing or swimming in cats. And just 5 years ago, I can remember by February, that was true. Like I mentioned, I'm happy to see Brian's protocols, because I would imagine we'll be integrating some of those guidelines. And our planned reopening date is May 9th, but it might be, it might not happen. It kind of depends on how things go, what our county commission says and the like. Vet care is an essential service, so we can kind of get around that. But we want to make sure that we have, that the community is ready to work with us to get the cats in. So those are the 3 things that Stacy had mentioned about talking about. And that's my part. I did it in less than 10 minutes. Yay!
Great job, Audrey. Thank you so much. I really appreciate your very concise and organized comments. And I've got, we'll deal with questions after everybody shares their thoughts. But thank you very much. For folks of you that are wondering why you weren't seeing Audrey up on the webcam, we're just trying to economize on the broadband. We were a little bit sound glitchy when we were doing our sound check. So for Audrey and for Ruth, who have a little bit less strong internet, we're going with just sound. And then Karen and Dr. Pizano and myself will use our webcams. But just for the 2 first panels, we're doing sound only. So I am going to unmute Ruth. Ruth Steinberger, are you out there?
Yes. Hi, Stacy.
Hello. So Ruth, feel free to introduce yourself and share your thoughts.
Okay. First, thank you so much, Stacy and Audrey. That was a great presentation. I am Ruth Steinberger. I am the founder and now ED of Spay FIRST. And we are focused on animals that are living in communities with chronic poverty, underserved areas. In the US, that's rural areas and small towns, tribal lands. And we are researchers of injectable, non-surgical fertility control products. However, we are active with several different types of clinic models. Mainly MASH and mobile, and we partner with some clinics that are in rural areas. So I was looking over the questions that you had sent as thoughts for today, and the last month, I think this hit everyone. Really, everyone was taken by surprise. Nobody, of course, expected to be looking an emergency like this in the face. And of course, with cats, it couldn't have been a more critical time of year, especially for cats that are living outdoors. What impressed me here was that several organizations immediately deferred to our state veterinary board as soon as questions came up. And that gave us a framework to make sure that what we were doing as a whole was compliant and not risking some kind of sanction later on. And at that point, a lot of information was floating around. No one knew exactly what was or was not going to be okay. our veterinary board recognized in an email that animals that were at risk of pregnancy do create an essential need. So that was something that said, obviously cats that are allowed to roam outside needed to be fixed this time of year. So it left veterinarians and clinics trusted to make safe choices, to remain safe, but to prioritize those animals that are at risk of giving birth. So while some organizations did close, others remained open and really prioritized the animals that were either at risk of pregnancy, were already pregnant. For example, that's all cats that are allowed outdoors this time of year. And of course, it left it up to the clinics to look at their facility and figure out the best ways to distance, the best ways to get people in and out the door. And my gut level feeling is that these protocols will be needed for a while. You know, we're hearing that this may be more ubiquitous than it was thought, that there may be an upsurge in the fall. And so I think the more people put thought into this and the more people look at how they engage these protocols, the better. For example, Oklahoma State University has a shelter medicine department, and they actually never closed down. They continued services on a limited scale, and they had very detailed intake procedures. And the department, I know we shared that with you, Stacy. So you should be able to get that protocol. And essentially what that did was it left the animal, if the pet was, or free roaming cat was in a pet carrier that was placed in a certain space and the person was instructed to get back in the car, the staff from the OSU came out with gloves on, sprayed off the handle, took the animal back in. If not, if it was a larger dog on leash, there's different protocols. So Oklahoma Spay Network continued to hold clinics. That's on the Texas-Oklahoma border. It's a very, very poor area. So clinics were held throughout, and they also had a safe intake and release procedure that was very similar. People did their paperwork. They filled out their paperwork inside a vehicle. There was one person that took the animals in and out, or still is taking the animals in and out. They are fully gowned, masked, capped, and gloved. Tulsa SPCA, I spoke with their director just yesterday, and they continued to alter in-house animals. They focused on some outside animals that were either possibly pregnant or had some other issues that couldn't wait. So I think what kept people moving forward with these clinics was, not only was it difficult to close down, but Julie Jacobson, who's I know is in the audience right now, she and I speak about the rural areas, and where you are in Tennessee and here in Oklahoma, literally this middle third of the United States, from the Mexican border all the way going north to the Canadian border, the states have, many of the towns have little town, what they still call dog pounds, but the counties that they are within have no sheltering available. So spay neuter is the only means of preventing more animal suffering in much of the country. And so for us, it is truly the only tool in the box that that makes it possible to get ahead of the suffering before it happens. And Julie calls it the only tool in the box, and it truly is. So in rural, low population, low income areas, spay neuter is so critical. And what I saw is clinic operators going, oh my gosh, I really can't just close this down. So Dr. Nicole Morton in Muldrow, Oklahoma, she was looking at, how to do a safe check-in process and how to keep people distanced in the parking lot and be safe. She's on the Arkansas line, someone else on the Texas line. Everybody was doing their best to create safe protocols that kept everyone gloved, everyone masked, and everyone distant. And one of the obstacles was, of course, as Audrey said, a lot of no-shows. People were either afraid to come to the clinic with their pet, which is very understandable, or they were simply unable to travel. People who had to get a ride, who had to carpool, couldn't come in. So, the plan of action moving forward here, everyone that I know who has downsized, the few that have closed are planning a soft reopening. They're planning to get the numbers back up to speed, and keep safety measures in mind and in place. And of course, right now, supplies, there's availability issues of many of the supplies we need in clinics. So, my hope is, and this may be a silly amount of optimism, but that as communities realize what all of this has meant to have so much closure in this country, that we have to focus on spay neuter to really ramp up ways to strategize, to look at how we're going to get female animals in this time of year. How can we ramp up our effectiveness? And of course, keeping these protocols in place and honing them, because we still really are at risk, obviously, and will be for a while.
So Ruth, thank you so much for your comments. And what I'll be doing is collecting the questions for the end. And so folks, if you do have questions for Ruth, put them in the questions box and I'll be gathering those, because some of the questions may pertain to all of the panelists. So we'll sort of gather those up. But Ruth, that's excellent. Thank you so much for sharing today. Appreciate it very much. Great news. And then, just as also a reminder, the Oklahoma State protocols are in the handbook that Brian has put together. So those protocols are out and published in his handbook. So that's great. All right. Thank you again, Ruth.
Sure. Thank you. It was a pleasure to be here.
All right. Quickly, before I do that, I introduce you, I'm going to do one other quick poll. Did your organization receive PPP funding? So we have 20% yes, 29% no, 26% we did not apply. What is PPP funding is 17%, and then 9% is other. And I'm not, if you did put other, put that in the questions box, because I'm not sure what that would be. So, and then what I'll do is I'll explain the PPP funding. If the panelists don't refer to it, I'll talk about it at the end. We're going to go back to Karen. Karen can wave to the group. She's got that beautiful fur ball in the background there, and always advertising, which is great. Yeah. And Karen, I'm turning the microphone over to you.
Hey, thanks for hosting this, Stacy, and thank you to panelists for coming, and for everybody who's watching today or watching later. It's just such a reminder that none of us are alone, and none of us are doing this alone, and we're getting great ideas from each other and great tips and things that we're doing. We're getting reinforced, and we're also getting new ideas. It's really beautiful, and it's just so powerful that even on a Saturday, we're also dedicated. So thank you, everybody. I am Karen Kraus, the director of the Feral Cat Coalition of Oregon. We are a high volume spay neuter clinic. We do see, even though feral's in our name and feral is our focus, we do about 66%, so 2/3 feral and stray cats, and about 1/3 pet cats. Our goal is to see fewer free roaming cats in our community, and we do that through TNR for the feral cats. We are community based, so it's the people out in the community trapping the cats and bringing them to us. We have lots of traps coming and going, so as we ramp back up, how we get those traps out into the community and back is a key piece of what we're doing. So we are currently closed. We've been closed since the 20th of March as well. And it's because the governor put a ban, a halt on doing non-essential surgeries and protection of PPE and social distancing and everything everyone's talking about. And we work closely with our Oregon Veterinary Medical Association and the examining board to make sure that we are following what's intended in the law as well as what's expected. We thought for a moment we could open up on May 1st when they opened up other elective surgery opportunities, and I've kind of been reminded that we're not included in this round. So right now we have a meeting next week to find out when we can officially reopen. And I also want to reinforce, we do care deeply about the people watching the cats, the community as a whole, and our staff and volunteers. So it's been devastating to not be helping the cats, but it has been very important to being able to be there in the long run. There's short term and there's long term. And as you've probably realized, we're in a marathon, and it's going to be one day at a time after we kind of get back into it. So one of the things Stacy asked me to talk about was fundraising. I couldn't help but grab one of my event posters and put it behind me. It's our fur ball. We hold an annual fundraiser every May. We've held 22 of them. We had one set for May 2nd and had to cancel it due to this pandemic. Pretty rough going, right? We're already closed. We're not bringing in income. And now our biggest fundraiser of the year is off the books. Scrambled, sent out a mailing, sent out emails, posted online. And we're very fortunate to have a match. 2 incredible donors gave us a match, which always, always, always motivates people. So it doesn't matter how much it is. I mean, well, you wouldn't want it for like $50, right? But you can even get a few different donors together and create a match and send that out to your supporters, and you will be surprised, pleasantly surprised, at how when I give you $1, it becomes $2 is motivational. And it was for us, and it got us closer, but it certainly didn't fill the void of losing this key event. So we're also doing an online auction. Many of you have probably tried it or are trying it. It's got its pros and cons. The pro, of course, is that you're going to bring in some money. And what I would encourage is that if you do this path, make it some form of an event for those who would have attended so that they really still feel connected. For us, it's significant because what we're trying to tell people is, even though we're not in operation, we need your support. That's a message that can be really hard for some people to ask for. And I understand that. And I've heard today and in other webinars that people have a concern it's hard to even ask for funding to help for spay neuter. I kind of get it, but not really, because I've been doing this for 20 plus years, and I've been asking from day one, and people have given. And people who care about animals always. And they'll give today. They might give less, but they care. And everyone's looking for a way to give back. And helping the animals is if it's in your heart, it doesn't matter if there's a pandemic or not. So we ask, and we give people a chance to participate, a chance to give back, and a chance to help. And people who believe in spay neuter, they get it. With us being closed, they understand the impact. We had a record year last year, a 25% increase in our service need for our services. In the first 2 months of this year, even higher need and cats coming to our clinic. We get it. So you know what we're doing? We're telling the story. This is where we were. This is where we are. This is where we're headed. And you have your story, and you can tell your story, and you can get people involved, because we're not going to come out of this without a ton of spay neuter. And some people have said it's not that sexy to ask for it. Well, kind of, in a way. What is more sexy? It's spay neuter, right? But I have to say, it is, we're on the front lines. This is what's going to make animal welfare get back to where to the path we've been on, to not having to have animals at risk of euthanasia, of not having animals at risk of living on the streets alone with unknown outcomes. So we are on the front lines, and just communicate and tell your donors, use social media. If you don't have the funds to get out there and do mailings, that's okay, or hold an event, even online, that's okay. Use what you have to communicate, and talk to your volunteers, get them involved, have them spread the word to their friends and family members. You are essential to the community. It's a beautiful service that many people may not even know about. Use the regular media. Do what you can to get the word out and ask for that support, because it is there in the community, and none of us are going to be able to get enough grant funding. There just isn't enough, right? So we have to work in our own communities and our own networks, and get those funds for our programs. So we've got a lot of different approaches that we do throughout the year. I'm happy to talk with people offline, or if you've got questions today, and inspire you to raise the much needed funds. If you're not that person to ask, maybe you've got board members, maybe you've got volunteers. Keep asking who's willing to ask people. You're not begging people for support. You're giving them a chance to be included in a solution, and a solution your community needs and the animals need. So I hope I filled your heart with some hope, and happy to take questions later.
Karen, thank you so much. That was wonderful. And I wish you luck with your online auction. And I can tell you, I'll share a secret. The Merrimack River Feline Rescue Society is doing an auction, an online auction right now. And I think their goal, it's a small auction. Their goal was to raise like $6,000 or $8,000. And I think that they're already at about $12,000. So you think people aren't able to give right now, and they really are. So it's an okay time to ask, because there are people that do want to support the organization. So just
they do. And ask your volunteers if there's things you need. If you can't get going because you don't have masks, your volunteers will make masks. In fact, I almost forgot. We have this very cute little kitty cat mask that one of our volunteers' moms, well, a bunch of volunteers have made, so that everybody can have, we have multiple masks, like everybody, volunteers, which will be limited in the beginning, but over time, that we can get them out to everybody. We've got volunteers at home folding newspaper to go in the bottom of traps, collecting newspaper, just keeping them engaged. And each one of them can also be a future supporter, both financially. So creativity, and just asking.
Yes, excellent. So Dr. Pizano, who was a feature speaker at the Online Cat Conference back in January, is joining us today to share her thoughts.
Thank you so much for having me, Stacy, and all the amazing panelists. I really appreciate it. So Team Shelter is a national consulting company, and I help animal shelters all around the United States reach their full life-saving potential. I work mostly with public shelters, but a lot of private shelters as well. And I'm over the assessment and mentorship program for the University of Florida, and an advisor to the Million Cat Challenge. So I see a lot of different organizations and work with a lot of different organizations. So I want to start off with just some good news and encouraging news. Is, if you haven't heard, there is work being done on the national level for a spay-neuter rebound program, and funders getting involved and doing large-scale spay-neuter events like have been organized in Puerto Rico. Amy St. Arnaud was sharing that I think it was 40 or 50 days in Puerto Rico, they did 50,000 surgeries. I mean, these are serious spay-neuter, right? So that we are already planning on these major events across the country. And so stay tuned. We know that this has been incredibly difficult to pause on spay-neuter. And what we're seeing is a reflection of, Stacy, your poll, with Some spay neuter clinics remained open. Some were doing just emergencies. And there's veterinarians that said, well, I'm doing the emergencies. I might as well do all the shelter cats and dogs while I'm here. Male cats I can do by myself, so we can still maintain that social distancing. But I think that has been, and I think that everyone has embraced that social distancing is, and protecting ourselves has and will continue to be the most important aspect of it. And we're all at different levels, right? When you look at the CDC COVID map and you see the number of cases, it's up and down depending on what state or even county by county. So all of us are facing different challenges depending on where we live and what time it is or what month it is. Remember, 6 weeks ago, we had such little information. The other good news I wanted to share, if you haven't heard, is Tomahawk is doing a discount program for traps, and the code is MCC 2020. That's Million Cat Challenge 2020. So please take advantage to that. It's the perfect audience to tell you about that. And I also want to share that during this very tragic time and an unprecedented pandemic that has affected so many millions of people, I can't help but be optimistic about how this will positively impact animal welfare. And we're seeing it in so many different shelters that were really afraid to ask their community to foster, or really afraid to do open adoptions, and how we've seen communities rise up, and in these unprecedented numbers. I have to say, I'm one of them. I've always had cats and small dogs. I've never had a large dog, and I'm now fostering a 70-pound bully breed who I love, so I'm in that pool. But I think that this stay-at-home measures to prevent COVID have really been a secret blessing for us in animal welfare. And I want to encourage everyone, if you are working, I noticed a large percentage of you are doing your spay neuter within your shelters. So some of you are standalone spay neuter clinics, some of you are shelters. But we want to keep this going. We want to keep our communities engaged. We want to trust them. I have done assessments in Town A who tells me, we can't adopt here, we have to transport, so we need to transport to Town B. And then I go to Town B and they say, well, we don't have good adopters here, we have to transport to Town A. And it's, do people realize you're doing this with your animals? Like, how about everybody step back and trust your community? And just like Karen said, trusting your community, not just with Good Samaritans and fostering and adoptions, but with fundraising and asking for help. If people don't know, then they're not going to know how to help you. I had a shelter today said, we don't want to ask our current sponsors from our gala that was canceled because everyone is struggling. And my response to them was, don't make a decision for them. You just made the decision for them, and you don't know what their situation is. Maybe they'll give less, maybe they'll give the same, but you don't know. They certainly won't give if you won't ask them, and if you won't share what your needs are. And I think and hope that you have all experienced this outgiving of support and kindness. We have to give grace to one another during this time. There have been recommendations made throughout this response when COVID hit the United States in animal welfare, whether it was spay neuter or what shelter should do or how we should handle animals from COVID exposed homes. And all the recommendations were made with the best of intentions and what information we had at that point. Moving forward, all those recommendations, as you've seen, have evolved, and you've all experienced it, and the panelists talked about it. So they might have closed originally, but now, knowing this is a marathon, that we don't know how long we will be in this state, and when the curve will start to flatten, that we need to figure out how to still service animals and get back to spay neuter while doing social distancing. And so many of you are doing great things with all your technology, the wait, the name just escaped me, but there's that app that restaurants use. So clients are getting that when they pull in the parking lot, and then just like a restaurant, when you're ready to go, your cat or dog gets picked up outside. So we're seeing a lot of that. We're seeing a lot of shelters and spay neuter clinics being just incredibly innovative and brave. And I just can't tell you, I'm so proud of all of these shelters that have just taken this step and put faith in their community and ask for help in a different way. So just wanted to encourage you all. In the next couple of weeks from the Million Cat Challenge, we are going to have a really exciting announcement to help out during this time. So we will let Stacy know and get the word out to all of you. And I hope you are all part of the Million Cat Challenge. If you're not, please join us at millioncatchallenge.org. And with that, Stacy, I think I was with, I'm a minute under.
You're awesome. Perfect.
I
Excellent.
knew I could talk 10 minutes or 10 hours, so I'm pretty proud of myself.
Good job. Good job. Excellent. Excellent. So thank you so much, Dr. Pizano, for your thoughts and your comments. And so folks, put your questions in. And while you're doing that, I'm going to do a quick poll. And Karen, if you want to put your webcam on, are you able to get supplies for your clinics? 43% say yes, 10% say no, and 47% are unsure. I haven't researched it yet, which means folks are using the supplies that they have and trying to reuse as much as they can. So I think that's pretty interesting. I think the 43% is actually higher than I would have thought. So I find that very interesting. All right.
I'm glad to hear that, Stacy. Can I just make a comment too?
Sure thing. Yep.
So to those of you who haven't researched yet, I would encourage you to, if you only use one vendor, get yourself multiple vendors, start researching now just to be prepared to see what may be back ordered, what may not be, so you can be prepared moving forward.
That's excellent. Excellent. Yep. Great point. All right. I'm going to jump into the questions, and if we have time for more polls, I'm always game for that. This is a question for Audrey. So let's hope if Audrey, yes, you are unmuted. Audrey, when you first talked, you were talking about what is considered a high, you referenced a high infection rate. So there was a question of what is considered a high infection rate?
Well, to be honest with you, I don't remember exactly what it was, but at that time, our county commissioner, when they were doing the stay-at-home order for Alachua County here in Florida before the governor issued the stay-at-home order, he said one of his reasons is that the infection rate for COVID-19 for Alachua County, the percentage per capita, in other words, if you take the number of people that live in Alachua County and the number of people that were tested and have the disease, it was higher, that percentage rate, than any other county in Florida. Not by number, because there are counties, we're only 250,000 people or so, but the percentage was higher. And I thought that's not true. So I spent a couple hours and did the math, and he was right. So that played a small part in us deciding that we really, we weren't prepared to, our clinic model wasn't going to allow us to do it as safely as we needed to do it, particularly when you consider the fact that we had such a high percentage of infection. In other words, such a big percentage of our people were actually infected with COVID-19. That played into the decision. It wasn't the only factor, but it played into it.
Okay, excellent. And then I have a couple questions, fundraising questions for Karen. One thing that actually Karen Little brought up as a comment is just, if you do think about trying to do raffles, you have to be very careful about raffles online and checking the rules in the state. And I mean, raffles are funny things in their own way anyway. So just if you do something that involves raffling, make sure you do your due diligence and research with regards to that. Lots of questions about, for your auction, what are the types of items and what kind of software do you use for it?
We have a theme for each one of our events, and this year it was Parlez-vous Français. So we were going to France. So we got lots of French themed items. And then we thought, well, what do we think of when we think of France? You know, it's usually art, design, things that make you feel good. Of course, with Parlez-vous and being furball, you have to have cat things. So we actually kept it within very thematic for what we'd already collected. So we'd been working on the event for quite some time. And it's things to bring you joy. So it's nothing that's going to remind you of something you should be doing, like changing your oil. It's all just kind of pamper and related to the theme. And it's pretty. You guys, it'll be online starting May 2nd. So you can go to feralcats.com and check it out and bid on things if you'd like. But don't buy anything too big or we got to ship it to you. So you can buy the small.
I know that problem. I'm the one who provides beer from Vermont to bidders in Massachusetts. So yeah.
Yeah.
And the software that you use for the online?
We use a system called School Auctions. Or they're gonna. Oh man, I hope the person who helps us with it isn't like, Karen, you don't have that right. I always call it something wrong, so I think I'm closer on that. But they do a lot of the school auctions. And so it's something we use the night of the event, but they have an online piece of it as well. I know a lot of people use Greater Giving. That's another example of something similar. But School Auctions, I think is what it's called. There's bidding, it's owned by Tofino. Pardon?
I was going to say there's Bidding for Good. And there's Bidding Owl is another one. And the big thing to research with the auctions is just what their fees are.
Yeah. Well, we have a good connection with this one. It is owned by Tofino, so if you want to look it up that way too. It's very simple, and what's nice is if you don't do a lot of events, this is one to look at because it's set up for schools where the parents are changing every year, and you're still going to hold that local auction. So it has some good power to it, but it's not too complicated.
Excellent. And auction pay is another option. So there are plenty of different platforms out there, and you just have to decide and choose what it is you're looking for. Bidding for Good is more expensive, but yet then you'll get bidders that don't know anything about your organization and they just want the items, and they're sort of more random. And then like Bidding Owl does not have a large network. It's really, you have to have your own network behind it. So that's just another consideration. Going over to Dr. Pizano, can you please repeat the Tomahawk code? And everybody is blown away about the concept of doing a large spay-neuter event in this era, and how could that even be possible, referencing the model of Puerto Rico, and then saying, hey, we're going to do this spay-neuter rebound and have select cities and say, like, let's just go crazy in Atlanta. You know, how is this even going to be envisioned?
Well, I'm not on that committee, and so I don't have the details. They said, you know, in the next week or two, there'll be an announcement about it, and it's called the Spay Neuter Rebound Project. But if you go to the animalsheltering.org HSUS website or the University of Florida Maddie's Fun Shelter Medicine website and read the Puerto Rico Spay-a-thons, it will blow you away. They are literally in stadiums of like tens of thousands of people that sit in those stadiums, and the whole floor is surgery tables and surgery pods. And so it's those types of things. I'm sure they're planning different types in different areas. Some might be bigger, some might be smaller, but I'm not privy to those details yet. But Dr. Levy said, just tell everybody it's coming.
Right. I mean, the question is in imagining that in a socially distanced way.
Yeah. Right.
You know, I mean, because we may not be out of the socially distanced world for about, 24 months or beyond. So that's the big concern.
Absolutely. And that will be, I promise you, that will be part of it for sure. I also wanted to mention that a collaboration with Best Friends and Cornell and several other groups are coming out with spay neuter clinic guidelines. I understand that there are plans to merge with the neighborhood cats guidelines, so I think those will be forthcoming so that nobody's confused. They are trying to work together, but neighborhood cats came out first, so that's coming up as well.
Yep, no, that's great. And we're all about sharing and learning. The Tomahawk code, again, if you can just repeat that again.
MCC 2020. MCC standing for Million Cat Challenge.
Yeah, okay, I wrote it down. So if anybody needs to know, we can put it in the chat too. Amber Sitko has a question. She said, "Can you please let us know the name of the app?" Oh, I'm assuming that's the fundraising app. Amber, tell me if that's wrong. The auction app, but clarify your question if I've got that wrong. So just let me know. Okay, triage. I'm not sure who wants to take this question. Maybe Ruth. A couple questions about, how do we make the decisions on, like, how do you triage the spay neuter? I mean, how do you determine? I mean, as somebody said earlier, I'm not sure if it was you or someone else, but most cats are pregnant that are out there. How do you triage that situation?
Well, the veterinarians and clinics that I work with, I've spoken with here, have really felt that people who trap had to be a priority. Cats that have been sheltered or are in a home and known not to be pregnant are much lower priority right now. And that they just had to get in the ones that were known to belong to homes that allow them outside, which is common in the South, and making as many spaces available. And again, doing a safe check-in. And so that's really how they prioritized, was who was likely to have a litter before we can start ramping up and get a hold of, a plan, create a plan to do a ramp up that gets in everybody. Did that answer the question?
Yeah, it's a very difficult question to answer. Does anyone else have any comments on that question, on how you would approach triaging in your community?
So the answer is there's no perfect answer, but I would definitely prioritize absolutely getting cats out of the shelter. And even if it was going to be a foster care situation, if those males in particular are of age, get them neutered. If they're indoor cats, maybe they're indoor kittens in foster care or adopted and they're not of age, those are going to be my lower priority. So I think it just depends on what your capacity is. And it also, remember, might change day to day, but I'm going to want to I want to get any cats out of a shelter if possible, and then any cats that are perhaps, I don't know, even it's not negatively interacting with people, right? So the male is spraying or the female is in heat or something like that. But I think it might change day to day.
Yep. Okay. And Julie Jacobson is sharing focus on households with multiple pets too as a priority. Ruth, did you want to say anything, or Audrey?
I was going to say pretty much what Dr. Pizano said, is that boys are easy to do, and you can do that. We can even do that here in our office, but boys are easy to do. But for us with community cats, they're pretty much all cats and traps. And a lot of times you don't know unless it's a calico cat, whether it's a boy or girl. You just do what comes in. And our hope is that we have a backlog of about, I think I was told about 250 people that we moved, 250 cats that we moved when we canceled, and they're all set to be some of our first, on the first list coming back. And so we will try to get to them. Unfortunately, some of them may have already had kittens, because it's been, by the time we get back, it'll be 6 weeks. And so, but try to do whatever we can to mitigate as much problems as possible.
So Audrey, while I have you here, I think I'm not sure, but you probably are taking this into consideration where you're doing sort of looking at larger scale type events possibly as you ramp up. We have a question of, will there be guidelines for trapping, holding, and recovery? Yeah, I mean, it's a pretty isolating business, trapping, holding, and recovery, but maybe there are protocols for interacting within the community, but I'm not sure if that is being thought about also out there.
It is, and for us, we're trying to get the caregivers to do the trapping. And like you said, trapping is, I mean, it might be you and a friend that you're going to be with anyway, but it's a pretty much an isolated kind of thing. It's not a group event. We're looking at things to make sure when we go, we want to go pick up the cats to minimize people coming in and being worried about that check-in kind of interaction. So we're going out there, and they're supposed to have the cats ready in the traps. We'll wipe off the traps with a sanitizer, get the caregiver to sign the paperwork, get the traps labeled, put them in the van, and they'll come back to the clinic, and we're going to recover at the clinic and then return the cats. So we're trying to minimize that here for Alachua County. I'm not saying that that's what we'll do forever, but that's what we're trying to do. That's in our plan to get started, that we think that will be palatable to boards, because everybody needs to think in terms of how risk averse your board might be, because if the organization gets sued, it's the board that's going to suffer that. So we need to get the board backed in whatever it is we do.
Great. Dr. Pizano, I think you had mentioned, you were talking about like Open Table or something like that. It's like a check-in app. Is there something specific that you were referring to from when you were talking about that? Someone was asking about if there's like a specific app you're talking about.
Oh, there are specific apps. I mean, there's many of them, and I don't have them off the top of my head right now. But if you go on the Million Cat Challenge website, and Dr. Hurley did a 30-minute webinar the other day, and she's got several examples in there, and that's a webinar absolutely worth listening to about how we're excited to recreate the animal welfare system. But and I think some of them were actually ones, so there's lots of apps, but I don't know the list of names off the top of my head, but check out that website or that webinar.
Right, great. And if folks want to email me, I'll make sure I can find it and get it to you. And if I can't find it, I'll ask Dr. Pizano to help me find it. So any last questions, or Kristen, am I missing anything out here in the question box?
I think you pretty much got everything. I don't see anything you guys missed. Nice job.
So I hope folks will tune in on Monday afternoon at 4 o'clock Eastern time. We have Amy St. Arnaud with us, Dr. Jeff Young, and Anna Murren from Denver Metro Cats will be joining us on Monday, sharing their thoughts and ideas, and we'll have Q&A. Of course, we'll be doing polls. As you know, I love my polls. If you have any ideas, thoughts, or suggestions of folks that would be good panelists, I am booking my panels for next Saturday and the following Monday, so please do let me know. This will be recorded, and we will have it posted up on the Community Cats Podcast YouTube page. If you're an eager beaver and you need it within a day or two, whatever, email me. I'll share the rough cut, but Kristen always loves us sharing the YouTube link instead. So out of respect for Kristen and getting it up on YouTube. If you'd like to see previous pop-up panels, please go to the YouTube page, and we do have a couple of them posted there, as well as our Community Cat Voices series that we were doing when the coronavirus kicked off. So feel free to check out the YouTube page. We have lots of great information there. And I think we are good. I want to thank again our panelists so much. Thank you, Dr. Pizano and Karen, Ruth, and Audrey being able to join us today and share your thoughts. And I really hope I know we're going to make it through this. We may look a little bit different, but we'll make it through, and we will get all those cats spayed and neutered. That's for sure.
Thanks, everybody.
Absolutely. Thank you very much. Thank you.